Start and people can progressively join during the welcome. Good morning and welcome to this webinar on co-creation of innovative digital healthcare solutions. This is the 5th episode of the EcoQUIP Plus webinar series dedicated to health managers. Today's session will focus on the role of co-creation in public procurement for innovation, in their implementation methods, key stakeholders, and success factors. My name is Annette Rosanov, and I'm the Policy and Program Director at the European Health Management Association. And I will be the moderator for this session. Before we start, perhaps let me just introduce you, on the one hand, the EcoQUIP Plus project, and on the other hand, EMA, the organizer. So, the EcoQUIP Plus project is an EU-funded project which is co-financed from the COSME program of the European Union. We are in the final year of the project, so watch this space, because soon we will be able to share our learnings, findings with the broader audience. But before that, we have still a lot of things to carry out. The project is based on the challenge or the idea that approximately 10,000 hospitals in Europe face broadly similar needs. So the EcoQUIP Plus project allows for joint public procurement, which means that from the buyer's side, they can aggregate the demand, by this increase the market for innovative solutions. So that helps the efficiency, quality, and sustainability of healthcare, because it makes the development of innovative solutions interesting for the suppliers, because it's a bigger market for them, and it also helps to reduce the price and also to think longer term. You can see on the screen that we run 6 procurement projects within EcoQUIP Plus in 5 countries. They are broadly on challenges, on broader themes, which also helps them to collect and aggregate needs from other hospitals within the consortium, and also from outside, from third-party buyers. And they are seeking to procure innovative solutions from SMEs all over Europe. So this is about the project. As I said, secondly, a few words about EMA, European Health Management Association. It's the organizer of this webinar. We are a membership organization based in Brussels, and our mission is excellent health management for a healthy Europe. And our strength lies in bringing stakeholders together from the health management ecosystem and generate discussions like this one as well. So now, with this introduction and adding a tiny bit to the housekeeping rules, we can soon start our discussion with our panelists for today. So it is a webinar, a Zoom webinar. So by default, your microphones are muted and your cameras are blocked. The chat is disabled for the participants, but you can consult the chat, because during the session, my colleagues will add relevant links to the websites that we will talk about, and also perhaps relevant documents. However, the question and answer box at the bottom of your page is active, and we are encouraging you to place your questions at any time during the discussion, and at the end of the session we will take your questions. We will be live tweeting during the session, so you can use the EcoQUIP plus social media handle, and then you can tag us. We will promote your messages as well. And with that, we can really just go to the panel and introduce our speakers of today. So first we will have Miriam Martin. She's head of projects at TIG Biomed, which is a cluster organization in Murcia in Spain. She was the coordinator of the In-Demand project, which was a Horizon 2020 project on co-creation between challengers, solvers, with demand side and supply side, with economic support from funders, so regional funds. And she will talk more about In-Demand, its co-creation model, and also many other projects. And secondly, we have Francisco Melero, also from Murcia. He's R&D manager at CETAN, which is a technical research center, and he's coordinating the large-scale pilot activities in Murcia of the Pharaon project. Pharaon project enables active, healthy aging solutions, devices, tools, by integrating them on open platforms. So that makes the deployment easier, and he will talk more about the co-creation process in the Pharaon project. So welcome, Miriam, and welcome, Francisco. We are very pleased to have you with us here. I have briefly introduced your projects, and I hope that I did it in an accurate way. But I will give you the floor to talk more about your projects, and also perhaps focus on the identification of the unmet needs. Who would like to start? Miriam? Yeah, I see your microphone enabled, so you can start.
Okay. So thank you very much, Annette, and thank you very much, EcoQUIP, for inviting me to present not only In-Demand, but all these group of projects that we like to call at TIG Biomed impactful innovation projects. Let's say that everything started when, like 10 years ago, when we were involved in a project that was technology push. So companies were developing a solution, and then they needed to co-create. So it was quite challenging to find professionals within the healthcare organizations interested in co-creating, because the need wasn't there. I mean, it was something that was fully technology push from the companies developing something, and we didn't know if the professionals were interested. So at this point, we thought that we have to change the approach, and we need to start working on a demand-driven approach. And that's where when In-Demand appeared in 2017. So we started working in this project, and the idea was we identified the need with the professionals. You have the whole methodology on the In-Demand website, and I'm sure that Emma or the organizers will share the link. So the whole idea was, let's start from the need identification with the professionals, then try to identify or to look for companies that are able to develop a solution matching that concrete need, and then the co-creation will start. So by the end of the process, we will get a solution that will be needed by the professionals. So there will be a market. So there is a need there for the market, but at the same time, we will accelerate all the development process, and for the companies, it will be easier to access to the market. And we'll have a better understanding on how the processes in the healthcare market work. So that was in a nutshell what in-demand was about, working from the demand side and looking for companies able to develop these solutions, let's say.
Thank you, Miriam. So just by changing perspective, actually, you changed the whole process, I understand.
Yes, somehow. I mean, what we realized was that by working from the need, it was easier for the professionals to get involved in the process of co-creation. They really felt from the very beginning that they were part of the process. So they were interested in how the solution evolved, which was the impact that this solution could have in the not only in the patients, but also within the organization. So since 2017, we've been working with this different approach, but I think I will tell something later when discussing about how is the methodology and the different things and how we have evolved.
Yes, indeed. Let's listen to Francisco now and the identification on the unmet needs in the Pharaon project.
Okay, thank you very much. I would like also to thank you, Annette, and all the EcoQUIP Plus team for giving us the opportunity of sharing our results with under Pharaon. Well, Pharaon started from one cost action on delivering solutions for healthy and active aging at home, in the community, and at work. That was called Seldom. And within this multidisciplinary team, there was a very small group of curious members that wanted to go beyond that science and science part that the cost action or the cost program provides. So we saw a very interesting call in the Reason 2020 health cluster, and we decided to prepare something. Since the very beginning, we started, since the proposal preparation stage, we started designing the interventions of the program, taking into account a very strong co-design and co-creation focus. Well, we finally could start working on Pharaon, which is a project aiming at testing solutions integrated in open platforms for an active and healthy aging. The thing is that the largest scale pilot are being deployed in 5 different countries: in Italy, Spain, Portugal, the Netherlands, and Slovenia. And well, we have one of the first phase. The first phase of the project was to identify the requirements of the users, that are not only older adults but also their caregivers, formal or informal, and the health and care professionals, industry representatives, and also health authorities. And the design that we have, the thing is that the project started in January 2020, something that was, as you may know, it was a period that we could not do many things physically, but we had to move in a matter of a couple of weeks. We had to move everything online, but we could create different focus groups with different stakeholders and compile all the needs and requirements that led to a successful design of the intervention and deployment of the activities that we are currently performing, not only in the region of Murcia, but also in the rest of the pilots that are being carried out in the project.
Thank you, Francisco. So I see already a wide range of stakeholders being introduced in your first speech, but we will get back to that. Miriam, you already started talking about how actually the in-demand model was kind of lived after after in-demand, because in-demand is a finished project. So can you tell us more about how you kind of refined and worked with the model later on?
Yeah. So when we started with in-demand, we, I'm not going to say only, but at the need identification, we only counted with the professionals that they were like on a daily basis working with at the healthcare organizations. So we started with the professionals. We launched a call for needs. The needs were identified. We transformed that into a challenge, and so we identified companies able to develop the solution. But then we realized that maybe that way of identifying needs wasn't the most complete one, because we were leaving the patients outside the process of co-ideation, let's say, or co-definition of the needs. So in the next initiative that we were working, the Cherries project, we involved the patients from the very beginning. So when we launched the call for needs, we asked the professionals to partner with the patient association. So any need should be a partnership in between patients and the professionals. And if they wanted, they could even include a research organization. So the co-creation or co-ideation started from the very beginning, not only in the co-creation of the solution, but in the, let's say, origin of the need. The other area that we felt that the model was a little bit weak was the part of the adoption. Because we identified a need, a lot of people was involved there. Then we identified the company team, the healthcare organization, the patients were involved into the development of the companies. But then what happened after the whole process ended? Was it going to be a pilot? And I have to say there that we are at TIC Biomed, we are a little bit obsessed with the adoption. That is like a word that is in our mantra, and we really want to find a way to facilitate the adoption of solutions that have been co-created, have been tested, and have proven to be successful. So that is the other part. And what we did was to involve the, let's say, the managers of the healthcare organization from the very beginning to understand what the process entails, which were the KPIs, and just to say, look, if the KPIs are successful and we are really reaching what we said we were going to reach, and that returns on a better efficiency to the healthcare organization or better services for the patients, that means that we should be able to adopt the solution and launch a procurement. That's why we say that this model of in-demand is a way of procuring innovation. Obviously, we were working with, I'm not going to say little budgets, but we were working with a 60,000 euros budget. So we were not aiming to PCPs that have a €1 million budget. This is just for minor, but you could also use that for a little bit bigger ways of procurement. And the last piece of the puzzle, let's say, to say, okay, how can we improve this model, was to include some part of interregional activity within both the co-creation and the co-ideation. So we are now involved in a project within the I3 instrument. We only started in January, so I cannot really tell you a lot about that. But the whole idea is that the challenges are going to be identified by healthcare organizations, but they have to agree in between different countries which are the challenges, and the solutions are going to be developed also jointly. So that means that anything that is developed in a country could find a market in a different country. So that will facilitate, first of all, to use the resources in a more efficient way, because if someone has already been working on a, I don't know, COPD monitoring device, why do I have to reinvent the wheel? We can really start from there. Or if a healthcare organization in the Netherlands have managed to reduce the time of the patients being in hospital we could use that and then build from there in a different country. So that is the interregional level that we have now included in the model.
And that new project is called
Health Chain.
Health Chain. Yeah, we can also put that.
Yeah, but we haven't even got
a website. Yeah.
Yeah.
Yes, you said you just started in January. So if I understand correctly, that's cross-border.
Yeah, exactly.
Yeah.
Cross-border. Yeah.
Thank you, Miriam. So you identified kind of, let's say, weaker elements in the in-demand model, and then you improved it through different projects, which is a very nice and very but also sustainable way of working in projects. Now, Francisco, you started indeed already talking about the wide range of stakeholders whom you worked with, so users, carers, industry, health authorities. But can you elaborate more about the key stakeholders who are needed for the integration of these devices, tools, technologies, etc., on the open platform which you create in Pharaon? So whom do you have to work with on co-creation?
Okay, as I said before, so the thing is that the Murcia pilot brought together lots of key stakeholders at the very beginning when preparing identifying the requirements. It was key the participation of the public health authority of the region of Murcia, that is the SMS in that regard, because it helped a lot to, let's say, rise the importance of the intervention that we were going to deploy within the other adults and their caregivers, their former caregivers. The thing is that during the development during the deployment of the pilot, they were also key during the recruitment phase. But it was key, all those health professionals that were in direct contact with the patients. For the case of the Murcia pilot, the intervention is focused on let's say, patients above 55 years old suffering from any kind of chronic health failure. So it was key the participation or the involvement of cardiologists, nurses, and physicians that were able to directly contact and reach their patients and cheer them or involving in the development of the project. Another thing that was very key is that, given that our target group was not very keen on using technologies and also on data, it was very important to have partners from the academic field or the training field that were able to develop and adapt let's say, a training content, able to provide the needed skills on digital health and data literacy for participants being able to use the technologies and improve the adherence as well.
Thank you, Francisco. Miriam, would you like to add something on the key stakeholders needed for co-creation? You mentioned that you bit by bit kind of opened up the circle of stakeholders. So what I have noted from you was first only healthcare professionals were participating in the need identification, and then you opened it up to patients, research organizations, and you mentioned also co-ideation. Yeah, and then of course you had the funders as well. I mean, some regional funding also, or agencies, and who else?
Yeah, well, thank you for the question, Annette, because maybe that was not clear. we think that we started with 3 concrete profiles, and then we realized that profiles were not such, but they were roles. So we came to the conclusion that in order to put in place a methodology like the one we developed for in-demand, you needed a healthcare organization or an organization that is able to identify needs. So that's why within the need identification in the healthcare domain, you will have healthcare organizations, but it could be insurance companies, it could also be pharma companies, it could be patients. It's like, it's important to play with the open innovation here and really pay attention to the stakeholders that are able to provide added value to your definition of the need. So it's first of all, it's like an organization or a group of organizations able to identify the need because they are working on a daily basis on the area. Then you need another role, that it could be an organization that have funding to fund the co-creation. So this could be a regional development agency. That was the original idea of the in-demand project. But then we realized that sometimes healthcare organizations have got their own funding, even public healthcare organizations. Public healthcare organizations, private healthcare organizations, they have innovation funding. So it's any organization, any profile that have got funding that could be put into the co-creation process. And obviously then you need companies. But again, we realized that maybe it was not only companies, but it could also be like a technological center, as the one where Francisco works, or it could be a university, especially all the technical or polytechnic universities. They have quite sound departments where they are not only doing research, but they are doing innovation. So those are the 3, and then the 4th profile, it's what we call supporter. And it's a profile of an organization able to provide business support and go-to-market insights. Because sometimes, especially for SMEs, when you not only in the market, in the national market, but also if you try to scale up or you try to move to international market, you need an organization that maybe hasn't got all the information, but is able to provide you the hints on where to find it. For example, everything dealing with regulation, certification, that's really important when you are working in different markets, and you need to know it from the very beginning, from the design of the solution, because if you keep designing the solution and you don't meet the requirements, then you will not be able to sell the product or the solution outside your country or where you have developed the solution. So those are the 4: organization identifying needs, funding organizations, supporting organizations, and then the companies or organization able to develop solutions.
Thank you, Miriam. And I think it's very important the kind of shift that you have taken from the stakeholder types to roles, because that has an importance in scaling up. Because you in scaling up, you work across different health systems, where if you just identify a stakeholder type, people in that context might not be able to say, well, it doesn't make sense for me, or it's not the best stakeholders. So it can help the kind of larger scale deployment. But perhaps we can get back to that later. Before I ask next question, I would just like to remind our audience that they can post their questions in the question and answer box while we are discussing. I would like to go now to success factors of co-creation. So what do you consider both as success factors of co-creation? So what are the kind of ingredients of co-creation for you? Whoever wants to start.
Go on, Francisco.
Okay, as I said before, the involvement of the healthcare providers was key for us. The thing is that they were able to engage the other adults and their caregivers, and also, you know, the things that we have to involve us on the engagement of the technology providers able to understand and transform, let's say, all these key requirements, those emotional requirements that were compiled during the users, the requirements phase into technical requirements, and then able to be integrated in the open platform. Yes, I think that's all from my side. I think it's key to have the public authority engaged in that sense, especially those doctors and nurses that are in direct contact with the patient.
And Francisco, you mentioned that FARON is implemented in Italy, Portugal, Netherlands, Slovenia, and Spain. Did the other deployment sites also find the same, or are there country differences there?
All the country differences that during FARON we selected a set of challenges that the demographic change is bringing into for an active and healthy aging in different perspectives. Actually, the intervention that we are carrying out in Murcia is the one that has a, let's say, more clinical perspective. So there are other pilots that are focusing more on social aspects, like avoiding social isolation and avoiding unwanted loneliness. In that aspect, the key factors were rather different, probably from the social perspective of having social carers involved in that regard was a key element for them, and also to have the authorities able to let's say, to transform all the results that we are bringing into adequate policies that can allow to change let's say, the environment, not at individual level, the environment of those individuals.
Miriam, on success factors of co-creation?
Well, I know that for the participants, it's going to you might think, well, you haven't discovered the dynamite, but for us, all this process of working or procuring innovation, it really requires a change of the culture within the organizations, and especially healthcare organizations are big organizations, and it is not that easy to change the culture. And why do I say change culture? Because you have to, let's say, combine a twofold approach. On the one hand, as I said, this is a demand-driven approach, so it's really bottom-up. We want to count on the professionals, on the patients, so it's really bottom-up. But as I said, if we want the adoption to happen, we need to involve the managers from the very beginning. So we need to combine both approaches, running in parallel with the different priorities to make it possible that the solutions, the successful solutions, are adopted. Otherwise, professionals will be working on co-creation, and they might feel even frustrated because nothing happens after all the work that they have put into the co-creation. So the first thing is, for me, the key is change of culture. I haven't got the secret recipe to do that, but I know that we have to combine this twofold approach, bottom up and top down. Okay, and the other aspect is we are not knowledgeable on everything. So working on co-creation, doing things in a different way requires training. And by training, I mean explaining what we want to achieve. I mean, it is not about launching a call for need. Sometimes you need an example. It's like, what do you mean? What do you really want as a need? And you need to explain that. And maybe For us, it was obvious, but when you receive different questions regarding the same thing, it is maybe because you haven't explained yourself enough. So when setting all these processes, you need a sort of training. And when I say training, it's practical training. Explain all the stakeholders involved, why they are there, and what we aim to achieve. So those things are important. And the third thing I would say is put a bet on open innovation. Identify the stakeholders around you that might have already done what you want to do. Don't start from scratch, just identify which is the added value of each of the stakeholders, and use whatever is useful. Learn from what has already been done, and then build from there, instead of starting again from zero, from the ground. So those are the three things that I think I would really, I would like the participants to take home.
And just for clarification, so in demand and the consecutive projects, you aim for adoption, so doing really the in procurement if possible, although it was not part of the, I mean, you were aiming for it, but it was not part of the kind of contractual model.
Yeah, you are right. But at EcoBiomed, we are like practical people. It's like I'm not sure whether we aim for or we dream with adoption. But yes, we would like to find the way to ease the adoption processes and the procurement processes within the healthcare organizations. That I mean, it goes first through a better understanding on the processes and which are the barriers that stays within those organizations in order to launch a procurement. That has to do sometimes with legal framework, but it's not only legal framework. It's more the way everyone works and what we are used to do, and risk aversion. So that's the area where we are now trying to make it easier. And if I can just use, if any of the participants would like to apply this methodology that I have been explaining, there is another initiative that it's already on the chat box, Innovager. And within this initiative with Innovager, we will fund the healthcare organizations and the companies to put in place the whole process. So not only the need identification with some training on how to do that in the right way, to transform this need into a challenge. We will support also the healthcare organizations. Sorry, it's not only healthcare organizations. This is just by definition because we only work on health, but this call is open for any sector. And so we will help to identify the needs, to look for the companies, to support on the co-creation process. And this one has got the final part, and we will support the procurers organizations into the definition of the memorandum of understanding or the legal documents that might be needed in order to launch a procurement. So, and
all this will be funded by Innovager.
Yeah, everything is funded by Innovager. Healthcare organizations will receive around 50,000 euros. It's not exactly 50,000 euros, but it's around 50,000 euros, and companies will also receive another 50,000 euros. So that's and the call is now open until the 31st of March. So just
and is it on the Innovager website? Is it on the Innovager website, or do we need to post another? Website. Okay. So participants, it's a good funding opportunity. If you are provider of, if I understand, any kind of services, not only healthcare, but any sector services. Yes. Francisco, in your project in Faraon, adoption is not a kind of end goal, if I understand correctly. It is really the co-creation between the actors and then the deployment of the services via the platform, which is the goal. Is my understanding correct?
Actually, they are both. You know, first of all, more than co-creation is the co-design of the solution, so as to compile all and precisely reflect all the needs other adults in our pilot, and actually to accept the acceptance and adoption of such technologies by the partners themselves. Actually, we are able to, in some way, we are able to make changes. We are actually carrying out the deployment stage. The users they committed themselves to test the technologies for a period of 12 months, which is a very long period, and we are doing a very strong effort in terms of following up to with the participants and capturing all every single no matter how simple it is, every single advice or every single suggestion from the SARS to make in order to make further adaptation. So it's a mixture of design and also the science towards towards ensuring the adoption of the end users, not only patients but also the health professionals. Actually, the health professionals are the ones that are more, let's say, strict, or more, they are making more, let's say, a drastic change, requesting more drastic changes in the system.
And just a very quick question before we go to the questions in the question and answer box. And it might be provocative. Do you think that there are any kind of factual figures or data how much by co-creating solutions can increase the chances of adoption and procurement? Or just a kind of bulk figure from your experience? I understand, Francisco, for you, it is still in the progress, in the making. It can be we don't know, but it's just, I'm wondering if there is something.
I don't really know. I mean, we let's say that we only have this feeling, and from out of the experience of in-demand, what is true is like companies, the feedback from the companies was that they felt that they had developed solutions that were more addressed to the market needs, that it was easier for them to sell those productions or those solutions and put them in the market. Because the problem with the adoption is not that the solutions are not successful, it's the process within the healthcare organizations. That you have to allocate budget 1 year in advance, you need to launch a procurement. So it's all those processes what we are trying to identify how to make it easier, or as I said, train the procurement departments on how to make it.
Training should be part of it. But just wondering if it could be a kind of next project idea to kind of measure, because of course evidence is very important. And I'm very pleased that the questions we have come to health management. So that makes my life easier, because I also wanted to ask some health management related questions. How easy do you find it to involve senior managers in supporting innovation and co-creation?
Well, first of all, I think it depends a lot on the profile of each and every person. My advice is bring on board those innovators that every organization have. I mean, they are the ones that are going to be like really willing to support you in the process. It is true that regarding management, some managers are tougher than others, and that depends on how innovative they are. It really depends on the organization, honestly.
Francisco, what are your experiences?
From the CETEM side, we are having a management system based on innovation that was implemented lots of years ago, some time ago, that implies the implementation of innovation within any activity to be provided in our institution. And this was raised by our CEO and our board of directors. So first of all, it's important to have the involvement those managers so as to make innovation a success. Otherwise, it would be impossible.
Yeah, that's sure that you need them. But what I understand, what I sense from your answers, again, it's a cultural thing. How much? Cultural and personal. And then we have another question. Do you experience different innovation cultures in management boards? I imagine that it's more in cultural, in different country contexts. Which it's a pity because your project is just starting now, Miriam, which would be interesting for the cross-border.
Yeah, but I mean, I do think that there are differences, especially because the frameworks are different. And I mean, when we were working in demand, we had Oulu in Finland, Paris in France, and Murcia in Spain. And we started trying to define a common framework, and then we just allow every region to adjust it to their peculiarity. So as well as the framework is different, the innovation culture is different. But here I would like, and I'm sorry because I'm giving a lot of references, but here I would like to invite the procurers that are attending the webinar to have a look to the Procure for Health network. That's another project we are involved, and the aim is to create a community of procurers on innovation in health. And here the idea is creating working groups and also to exchange information into different ways of doing in different countries and trying to identify which are the common points. So have a look. There's a lot of resources available. There's a lot of, there will be a lot of training. There are differences, but I think it doesn't mean that it's better or worse. It's just different ways of doing things.
And I would, we have two questions, so I am in difficult position. Perhaps you could answer one by writing the last but one, and I would ask the last one. In some organizations, innovation is not rewarded. How do you suggest overcoming that? So Francisco, you mentioned that our organization is innovation management driven.
Yeah, actually, thanks to our innovation management system, we are able to, let's say, somehow, reward the success that we can achieve when it comes to implementing some innovations. One of the things that we perform is that the targets, we have a target of proposing at least 3 different kind of innovation, no matter how small they are. They can be for internal management, for product or services. And after that, they are being assessed, and according to that, we find such a kind of reward, a small reward for those for the staff involved in such suggestions. So there are many ways to if you Google and you can find some ways to reward this kind of innovation successes.
Miriam?
This is a key point in the description of job of more professional. It is not written that they have to co-create. So it's not about being rewarded. So it's not only about the money, it's about the time to devote some time to the co-creation. So what has been done in some of the hospitals we've been working with regarding co-creation is the management had allocated some time to those professionals working in co-creation to do the job with the solution developers. So, but as I said, it's not only about money, it's about time. It's like have the time to really work on a concrete
and then it comes again to culture. I would like to thank Miriam and Francisco for the interesting discussion, because we are coming to an end our 50-minute webinar for today. So thank you very much for the insights, Francisco and Miriam, that you shared with us. And I would like to ask my colleague Anna to share again the slides with us, because before talking about the EcoQUIP Plus Collaborative Buyers Forum, and I would quickly round up our discussions and talk about the next steps in EcoQUIP Plus. So today on co-creation, we have learned that it is a great process full of potentials for also increasing adoption and procurement, but for that some internal processes also have to be aligned with the procurement processes. Involve your top management, because that will also increase the chances for scaling up purposes. In co-creation, rather focus on roles rather than stakeholder types, and then you can better explain who are needed. As success factors, involve those providers who can engage directly with end users. And focus also on cultural change. So in co-creation, you need to make cultural change, and you need to embrace innovation in the whole organization. With that, I would close our discussion. I hope that it was a kind of accurate summary of what we discussed today. I would like to draw your attention to the EcoQUIP Plus Collaborative Buyers Forum, which is a LinkedIn group, and we are encouraging you to join this group. My colleagues also send in the chat the link where you can click and you can follow the group. And last but not least of all, I would like to pre-announce a last webinar that we will organize in May, and that will focus on using PPI to meet different challenges in organizations. So we will announce the date and the speakers soon. Thank you very much for attending this webinar, and you can see also Miriam's contact details in the chat. We will do as usual a summary report, an article, and we will also make the recording available on the EcoQUIP Plus website. Thank you very much, and wishing you a nice day. Bye-bye.
Thank you.